I got this question at least 100 times on a video I made about the 4-month-old developmental milestones, where I mentioned that it could be a red flag if baby's fists were still completely tight after 4 months of age. And I'm sorry this was confusing and distressful, but let's talk about it. So, babies are born with very tight neuromuscular systems. So, the way that their brain connects to their body, their legs are drawn up, they're kind of tight, their hands are fisted, and they have these primitive reflexes. And primitive reflexes are things that they're born with. Like if you touch their cheek, there's a rooting reflex, there's a sucking reflex, there's something called a Moro reflex, where they do that startle. And then there's a palmar grasp reflex. And that reflex over time should start to relax as the brain grows and makes new connections. After 4 months of age, we want to start to see that the hands are open more and more and more. Now, the specific percentage of how much they should be open versus closed really matters with the whole history of the child, such as, are they premature? Are there any other developmental milestones that seem to be lagging? So it in itself is not necessarily a dangerous sign, but it is something we watch for. Things that this could indicate if the baby is super tightly fisted at that 4 and then 6 month visit is that there could be something going on with the way the brain communicates with the muscles, or something going on with the muscles themselves. So, cerebral palsy, spinal muscular atrophy, abnormalities in the brain and the way that it works. This is not meant to scare you. Developmental milestones are just stop signs. They're just things for pediatricians and family practice providers to take a look at and start to determine, is there any risk with this baby's brain and how they're developing. So this is just a stop sign to tell your provider, hey, look for something else. Are they growing well? Is every other development okay? Was there any history that concerns me with the baby's brain? I hope this helps a little bit. If you have any more questions, please let me know.